Hello, welcome to the teacher channel, and it is wonderful to have you here. I am really delighted. Thank you so much, and I cannot thank you enough. Thank you for watching the video. And today I have an interesting topic. This topic should actually be interesting to you and to everybody else. So it is CPR 101. So it is an introductory part of CPR. And this CPR, this very presentation is a precursor to the practical demonstration that will be given, that will appear in another presentation, in another video. So I want you to be on the lookout, and you can subscribe so that when I release that video, when I upload it, you're going to get an alert, you get a notification. So today I will be talking about basics, okay, basics of CPR. That's the reason why it is called the CPR 101. I want to remind you that the main objective of this channel is to provide the education on emergency situations that require first aid. Emergency situations that require first aid. So this is why this channel is there, okay? So coming to this channel, you'll be able to get acquainted, you learn a lot about emergency situations and how to handle them when they show up. So I'm going to ask you to subscribe. Please subscribe, share, and like this video. Okay? Subscribe, share, and like. That is an encouragement to me, and that will enable you to get notified whenever I upload more videos, and more videos are coming, more interesting videos. I'll be talking on the issues concerning the heart, issues on stroke, choking, AED, many of them, heart attack, cardiac arrest. There are many topics I'll be talking about. So please, I want you to subscribe. So what is the goal? The goals of the present presentation. So the goals are, so at the end of this presentation, you will learn more about what CPR is, who should receive the CPR care, the objectives of CPR, the components of CPR, when to stop performing CPR, the CPR tests, and the attributes of high-quality CPR. So what is CPR? CPR simply stands for Cardiopulmonary Resuscitation. C for cardio, which is the heart, P for pulmonary, which is the lungs, and R is resuscitation, which is to revive somebody. So CPR is a life-saving care, life-saving skill given to revive somebody, someone whose heart has stopped beating normally, somebody whose heart has stopped beating effectively. So such an individual who qualifies to have CPR performed on him or her. Who should CPR be given? CPR is an emergency care given to someone whose heart has stopped beating effectively, okay? So that is the person who qualifies for CPR care. Somebody whose heart has stopped beating effectively. A person whose heart has stopped Breathing effectively is said to be in cardiac arrest. So you give CPR care to somebody in cardiac arrest. And who is in cardiac arrest? Somebody whose heart has stopped beating effectively. There are 3 possible patients, 3 possible recipients, 3 possible age groups who may receive CPR. The infant victim is somebody who is younger than 1 year. A child victim is somebody who is up to 1 year but has not reached puberty. An adult victim is someone who has reached puberty, and that definition is taken from the Heart and Stroke Foundation Manual 2015. Objectives of CPR. Cardiac arrest results in a heart that will not pump blood. Okay, we have seen that before. So cardiac arrest leads to a heart that will stop pumping blood. And the inability of the heart to pump blood will lead to deprivation of oxygen and nutrient to the cells of the body. Okay? Cells, especially the brain cells, cannot survive for long without oxygen. So if oxygen is withheld from somebody, the cells of the body, especially the brain cells, will not live long, will not survive for a long time without oxygen. The overall objective of CPR, therefore, is to manually pump the heart so that blood and oxygen will be circulated on behalf of the person. And remember, the person is in cardiac arrest. So when you perform CPR, you are manually doing what the heart is supposed to be doing automatically. When you perform CPR on somebody, you are pumping for the person. And that pumping is distributing the blood all over the body. And remember that oxygen is carried in the blood. So those are what you achieve when you perform CPR on somebody. Components of CPR. So one of the components is chest compression. And then the second component is breath. So chest compressions and breath, those are the 2 components of CPR. So when you do chest compressions, you pump the heart. You squeeze the heart to push blood. And then when you give breath, what you're doing is to introduce oxygen. So there is about 17% of oxygen in the breath that you give. Remember that atmospheric air, the air you breathe, is 21%. But when you give breath to the patient, to the person that you are helping, the person in cardiac arrest, there is 17% of oxygen in that breath. Cycles of CPR. CPR is performed in cycles. And what do we mean by cycles? A cycle of CPR is comprised of 30 chest compressions and 2 breaths. 30 chest compressions and 2 breaths. 30 and 2. Okay? So 30 chest compressions and 2 breaths. That is called a cycle. CPR cycle expression. So let me put it in a more compact, more elegant way, more mathematical expression for the CPR cycles, which is 30 and 2 times n. So where n is the number of cycles. So what that means is that you keep on performing 30 chest compressions followed by 2 breaths n times. The n is unknown at the start of the CPR. So it is unknown. You don't know how many times you will do it. When to stop CPR? When do you stop performing CPR? Remember that in the previous slide, it was shown that the CPR cycle, okay, comprises of 30 chest compression followed by 2 breaths and then n times. Okay, so but this n time, this n is not known. But then the question is, when do you stop? Is it an indefinite activity? Do you continue forever? So at what point do you say it is over, I stop here? So continuous cycles of 30 chest compressions and 2 breaths until. So there are conditions here. So this is a conditional term. So you have to continue doing this 30 chest compressions followed by 2 breaths until the patient starts breathing normally. This is actually the goal of CPR. So if that goal is accomplished, that's it. The emergency medical team arrives and takes over. You become too exhausted to continue. So you have been, let's assume you have done this several times and for long. But at this point, you can no longer push, so you have to stop. The scene becomes unsafe to continue, so this is on the basis of safety. Of course, you know safety is first. So if the scene becomes unsafe, nobody expects you to continue. A qualified bystander takes over. A qualified bystander, it could be a colleague, it could be a passerby, it could be anybody who knows how to perform CPR, can just walk to you and take over from you. CPR steps. Check the scene for safety. This is step number 1, and take necessary precautions. If the scene is safe, then check the patient. So check the surrounding, check the area, make sure it is safe, and then if it is safe, then you check the patient, okay? And how do you check the patient? You check the patient by tapping and shout. You shout and tap, and when you do that, you are checking whether the patient is responsive or conscious. So you're checking responsiveness or consciousness. How do you do that? Okay, shout and tap. Tap the shoulder, shout something like, hey, are you okay? Are you okay? Can I help you? So you are checking for responsiveness. You are also expected to check for normal breathing. Okay, how do you do that? You scan the chest, the patient's chest, for 5 to 10 seconds. So you scan for not less than 5 seconds, but not more than 10 seconds. So between 5 and 10 seconds, that's how long this check for normal breathing lasts. Breathing is normal if a person, the patient, has a regular and predictable pattern of breathing. If the person or patient breathes 1 or 2 times within 5 seconds to 10 seconds. So within this time between 5 and 10 seconds, if you expect a normally breathing person to breathe 1 or 2 times. Otherwise, if those two conditions are not there, the person is not breathing normally. CPR steps. Yell for help if patient is unconscious. Remember, you did your checks. So if that patient, after shouting and tapping, you discover that the patient did not respond, the person did not respond in any way, then you need to yell for help. You need to shout for help. You need the help now. Then either call the local emergency number, e.g. 911, and then put patient in a recovery position if the patient is unresponsive, but the person is normally breathing. The person is breathing normally, but the person is unconscious. So in that case, you don't perform CPR. You simply put the person by the side. Okay, we call it a recovery position. So because the person is breathing normally, you cannot perform CPR even though the person is unconscious. Or call the local emergency number, e.g. 911, and start CPR if the patient, who must be lying on a hard and firm surface, is unresponsive and not breathing normally. Okay, so to perform CPR on somebody, make sure the person is lying on a hard and firm surface, and that person must be unconscious and not breathing normally. The person is not breathing. The person is not breathing normally, and on top of that, the person is unconscious. So this person qualifies for CPR. Continue the cycles of 30 chest compressions and 2 breaths until any of the stopping conditions or event is met. Remember the 5 of them that I already described. High quality CPR. Your CPR is of high quality if 1. You push hard and fast at the center of the patient's chest. So one important attribute to high quality CPR is to push hard and fast at the center of the patient's chest. You push at a rate of 100 to 120 compressions per minute. Okay, so that means in 1 minute you are expected to put between 100 to 120 compressions. Okay, your compression is deep enough. Okay, your compression should be deep enough. And in children, you are expected to push down to 4 centimeters or 1.5 inches, or 1/3 of the baby's AP. AP is anterior posterior diameter. If the patient is a child, okay, child victim, you are expected to push down to 5 centimeters or 2 inches or 1/3 of the AP. If an adult, remember you're using 2 hands here. This is 2 fingers. Here you're using 1 hand, and here 2 hands, and then the depth is 5 centimeters or 2 inches. So this is the depth of your compression for the 3 age groups. Very important. You allow the chest to recoil fully between compressions. So you should allow the chest to recoil fully, 100% recoil between compressions. This is what we call diastolic, and this is very significant, very important, because it is when the chest is recoiling that blood flows back to the heart. So if you are not doing this, the blood will not return. And what is the essence? The essence of CPR is to push blood. So if the blood is not returning, then what are you pushing? Performing CPR. So you kneel beside the patient, locate the center of the patient's chest. If the patient is an infant victim, use 2 fingers. If the patient is a child victim, use 1 hand. If in doubt, use 2 hands. If an adult victim, you use 2 hands. Continue giving 30 chest compressions followed by 2 breaths until any of the stopping event happens. We have already described the stopping events. Performing CPR, giving breath. Open the airway, head, teeth, chin lift. So you have to open the airway. If an infant, open to the neutral or sniffing position. So for an infant, be careful not to overextend the airway, otherwise you are going to block their airway. They have very tiny airway. So for babies, you have to open their airways to neutral or sniffing position. See the pocket masks or pinch the nostril if you are doing mouth to mouth. So if you are using the pocket mask, make sure you seal it. They should be airtight so that your breath will go into the airway instead of leaking off. Deliver 2 breaths over 2 seconds. That is 1 breath over 1 second. So 2 breaths over 2 seconds. Meaning that 1 breath should be given over 1 second. Watch for visible chest rise. So as you are giving the breath, you are looking toward the chest. So the chest must rise. Okay. Otherwise, your breath is not going into the lungs, meaning that the lungs are not inflected. So you have to watch for chest rise when you blow. Thinking ahead. Please kindly watch this space for more interesting topics. I told you that more interesting topics are coming. Okay, and the objective of this channel is to educate, to bring evidence-based learnings. Okay, is to educate, to inform you on emergency matters. Remember that emergency can happen anytime, any day. Okay, emergency is an unplanned incident, okay, that comes around even when nobody expects. That's why you call it emergency. And we need to be ready. We need to be equipped. We need to have the skills. We need to learn what to do when the emergency show up. Okay, and this is what this channel is about. It is oriented toward equipping you, equipping everybody. It is oriented toward making us ready, emergency ready, so that when emergency happens, you know, we know what to do. We'll not be at a loss. Okay, we'll be talking about, you know, some of those hot topics, some of those, you know, interesting topics: heart attack, cardiac arrest, stroke, you know, shock. We'll be talking about choking. We'll be talking about how to use AED. There are many things I have in stock. So this is why you have to, subscribe. please subscribe. Subscribe, because it is important. It is important. So thank you so much. Thank